Let's go from your kids to your parents. Mom and Dad, they're getting up there. Each year they need your help more and more. It's at a point where they can't drive anymore and you have to take off work to get them to the doctor's appointments. Well, not anymore. House calls, they're making a comeback and they're going high tech. A program that found success in the South is moving north here to Maryland, bringing entire doctor's offices right into your parents' home. And joining us right now to explain how the program works is Dr. Jennifer Hayashi, who is the medical director of Baltimore's MedStar Total Elder Care. I don't see a negative in this at all. House calls to our parents. I don't have to drive mom and dad to the doctor's office?
That's right. What's not to love?
Well, who qualifies for this, doctor?
So frail older adults who have multiple chronic illnesses that make it difficult for them to get out of the house to go to routine things like doctor's visits.
Do they have to go through a test first to find out if they qualify? Or
there's a phone screening. If you call our phone number, then our nurse or our coordinator will talk with you and figure out if you live in the right zip codes and if you qualify for the program medically.
You come every day?
We don't typically come every day, although we can do that in the short term if it's going to keep somebody out of the hospital and keep them healthy.
How long are your visits?
The first visit is usually about 90 minutes. Follow-up visits are anywhere from 30 to 45 minutes, typically.
What is typical? Like, what do you do when you go into a home and see mom and dad? What's the typical thing?
So I like to think of it as all the same stuff that happens in a regular doctor's office, but more. Because we can do all the same technology stuff that happens in a doctor's office, the vital signs, drawing blood, doing basic tests. We can even send x-rays to the house if necessary. But mostly, I think what's important about our program, it's a team-based model of care where a bunch of people, a nurse practitioner, a doctor, a nurse, a coordinator, a social worker, are all working together to support the family and the patient together to keep them at home.
Excuse me, doctor. Come back. Do you see anything wrong? Do you see anything negative? But I thought so. Nobody's saying it. This is incredible. Is there a cost, or can insurance pick it up?
It's covered by insurance, just like normal doctor's visits.
Why have we, we used to do the house calls back in, well, when I was young. It's starting to come back now. What a great time this is. You've seen it work, though.
Yes.
You've seen success, haven't you?
Yes.
Tell me about that.
So the program in the South that you talked about earlier, it was down in D.C. It was started about 17 years ago at MedStar Washington Hospital Center. And they started it with the same idea to go to the homes of frail older adults and take care of them when and where they needed it. Improve their quality of life, keep them out of the hospital unless they absolutely needed it, and help them transition to the last part of their life.
The only thing I can think of is mom and dad, they love you so much. They want you there every day. Hey, can you come over and check my blood pressure?
So we do a lot of phone follow-up,
okay,
so we can reassure people and also help them figure out if they really need a doctor to come to the house at that particular moment.
What a great idea. All right, so what do? We get on, where do we go right now? People are going to be clamoring for this right now, so where do they go, doctor?
So our website is medstartotaleldercare.org. Our phone number is 443-444-6100, and you'll talk to a live person that will guide you through the steps of figuring out if you qualify for the program.
Are you making the call?
Am I making?
Yeah, will you go to the door?
Oh, yeah, absolutely.
Oh, well, good then. I'm calling. Thank you. Thank you, Dr. Jen. Thank you very much.
Thank you.
This is great. Love it. All right, let's take a look at weather right now.